It's a huge mistake, in my opinion, to close schools. The academic damage was horrendous. We're still experiencing the consequences of it.
State Superintendent of Education Tom Horne addressing concerns of a recent surge in COVID cases in Arizona as students are heading back to school to start the academic year.
I think some students will be handicapped permanently as a result of not having been able to go to school for that time. So if anybody talks again about closing a school, I will fight it as hard as I can.
Horne says he feels students are still making up for lost time after schools transitioned to virtual learning when the pandemic reached its peak. So his goal is to keep kids in the classroom. But what if they get sick?
If a student has anything, if it has a normal cold, we urge them to stay home so they get the proper rest and so that they don't infect other students.
Horne, citing the CDC's new recommended guidelines that treat COVID like any other respiratory virus, says students should not be at school if they are sick.
We do not want, the patients to return to school or to work until their fever has resolved and they've been without a fever for at least 24 hours.
Dr. Wasim Balan, an infectious disease specialist with Phoenix Children, says the recommendations are now in line with those for any respiratory infection, but says if you have any symptoms of a virus, it's still important to get tested.
That would be helpful for multiple reasons. Number one, obviously, the knowledge of what the disease is and what the expectations are going to be, but that also helps to protect some vulnerable people that the patient might be around.
Though the 5-day isolation period is not recommended anymore, the CDC is still encouraging masking in public for up to 10 days after someone is diagnosed with a respiratory illness. That's just to help stop the spread. Dr. Balan says it's not confirmed yet, but there will likely be an updated COVID vaccine this fall, similar to how we see new flu shots every season. Guys.